Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Shivashankar Marajakke. He is the chief neurosurgeon at the medical director of Sri Siddhagiri Advanced Center and Research at Kolhapur, Maharashtra. He did his MBBS from Karnataka, Bijapur, that is BLDE. Then he did his MS General Surgery from Government Medical College, Surat, and he's a gold medalist, double gold medal he has got. And after that, he did his MCH in neurosurgery in Sri Chitra, a prestigious institution. What is important is, though he is born in Karnataka, he is serving in Maharashtra, but he's irrespective of which part of the country they are, he is giving them the best treatment at the affordable cost. And that is the most important. Let us talk to him and know about what is new and what is the importance of the technology, along with that, how to have the compassion and kindness to the patients. Welcome, Dr. Shiv Kumar.
Namaste, madam.
Shiv Shankar.
Namaste.
Namaskara, Shiv Shankar. And
Namaste.
nowadays, I know the people are so worried. Anything, little thing, they have so much worried. But when something goes wrong with the brain, it has to be really worried about. And as it is, they have enough headache because of the disease. On top of that, the social fabric and the other things and the money cost that is involved, they have to sell their land and everything, and they are really shattered and they come in a very disastrous state. So how do you think is importance of the technology as well as the kindness, and why it is so important? Please let us know.
Namaste, ma'am. As you all know, that brain and spine is one of the most important part of the whole body, and it controls the every organ and every millimeter of our body. So when something happens to this, the implications and the consequences are expected to be quite grave. So in this scenario, when patients have these diseases, they're already afraid and they're worried about the financial aspect. At the same time, they don't know whom to choose and who is the best in this, and what will be the consequences. So in that scenario, micro neurosurgery has definitely changed the way the neurosurgery was being performed in the last few decades. So in this, the technology, what we need, it requires a lot of funds. So the prices increases, and we need to have the technological touch to improve results, precision, and even decrease the complications and consequences of the complications. So at the same time, we have to balance the disease part, the treatment part. At the same time, we have to handle the patient's psychological part also. So this really requires a human touch. So we just can't fake it. We have to be kind from inside, and we have to be compassionate from inside. So we should be bothered about the disease as they are bothered as themselves. So when we approach a patient, we cater the services to the same extent. If that would have happened to any of my family member, probably I would have done the best and the same care that we transfer to the patients, where that definitely gives them a comfort of a family. And that is what matters to the patients at the most needed and the worst part of their life, when they're lying in the hospital on a bed with some diseases to the brain and spine.
Yeah. This is very, very, very well said. And I really know many patients who come and have said, by listening to you, half of our tension is gone and our disease also is gone. But in reality,
Yes.
when I was treating my own mother, I did the angiogram. When I asked my father, he said, whatever decision you take for others, you take for your mother. And remember one more thing, any patient who comes to you, treat them as your mother. And that is the most
Yes.
important. When we start treating them as our own family members, there will not be any
Yes.
sort of disharmony or negligence or anything will be there. And what is important is you are doing more than 500 brain surgeries in your center, though it is a small place. So please tell us about your center.
Ma'am, I am presently working in a hospital by name Siddhagiri Hospital and Research Center. It is located in a very small village by name Kaneri Mutt. It is around 20 kilometers away from the Kolhapur. It is just on the border of Karnataka and Maharashtra. The Karnataka starts around 7 kilometers from here. So most of the patients who come are from Maharashtra, and half of the patients they come from Karnataka. So this hospital is located in a village by name Kanerimat, which has a population of around 5,000. And the place where I work is a religious and spiritual organization. It has a history of 1,350 years. And the present Mathadipati, who is a 49th Mathadipati, he is Param Pujya Adrushya Karsita Swamiji. He had a dream of having a hospital in this village setting, which can have the same facility as the metro cities corporate hospitals have, and the
Yes.
same care can be transferred to the patients at no profit, no loss. The concept was Niradharana Adhar. So that is how the hospital began in 2010, and we have a hospital spread across 17 acres of nature's beautiful
Wow.
landscape. We have 3 lakes around, full greenery, and at the same time, this has a vibrant vibrations of spiritual, and the place itself has a 1,350 years spiritual Mathadipatis were here. So very strong vibrations that help to heal the patients in better way. So
Yes.
we have all the facilities and subspecialties, and though we are located in a village and we are charitable, we have the topmost technology that even any metro city corporate hospitals would dream to have. So we don't compromise on the technology, but we do compromise, and we significantly reduce the amount the patient pays to the hospital for
Yes.
surgeries or the investigations or the treatment.
Great, great. A very
And I'm here
noble
for the
thought
last
and a noble idea. Yeah. Please go ahead.
yes. So I'm here for the last 12th year now, from 2015, and now we have established state-of-art, very well-known neurosurgical center in India and across the world also, known for the most complex surgeries being done at a center like mainly brain bypass surgeries, epilepsy surgeries, endoscopic skull base and brain surgeries, and complex brain and tumor surgeries, aneurysm surgeries. So all the highest level of complications, complicated surgeries we do with a touch of the most advanced technology and the finest human beings who
Yeah.
intend to heal the patients rather than have a commercial angle. So that is what is the beauty of this organization. And we work with the same frequency that the organization has, that we want to heal the patients beyond financial barriers.
Okay. That's a really a great thing, because we know that the Satya Sai is doing the free heart surgeries all over the world. But giving the affordable cost, the neurosurgery, I don't think any center is doing that way, because that also
Yes,
costs in lakhs. And you
yes,
have combined the two EQs.
yes,
Well, that means, you have emotional quotient as well as the efficiency quotient. So
yes.
both are well balanced in your center. And that's the reason I think you stand out compared to the other centers. And now you said the complex and the challenging cases. Which is the most challenging case that you have done? Can you just narrate one case for us, our viewers?
Yeah, we most of the surgeries that we commonly do are quite challenging. Out of which the brain bypass surgeries, epilepsy surgeries, aneurysm surgeries are the most complex surgeries that can completely transform the lives of patients forever. So out of that, I would like to quote one of the brain bypass surgery that we did around 7 to 8 years back. She
Oh,
was around 50-year-old lady who had around 3 kids, and she was diagnosed to have a tumor, aneurysm, that is a ballooning of the blood vessel. So
okay.
there is something called as intercalated artery which supplies the brain. So the
Hmm.
moment the site where it enters the brain, there was a big ballooning, and that was
Okay.
compressing of the eyes nerves, and she was having double vision and even the
Okay.
decrease in vision. So for which she had seeken help around, and since it was quite complex, she was referred to Bangalore. So where she was worked up and planned for bypass surgery, but somehow they went for 7 to 8 times and they could not get the surgery done. For which she
Hmm.
neglected, and one fine day she came to us with the aneurysm had grown so big that it was coming out to the molar tooth here. It had destroyed all the bones around the eyes and the sinuses. and that is the world's largest aneurysm surgery that was successfully treated for the first time in the world. So that patient was bleeding through the nose, through the mouth, and she was almost on the deathbed. And for us, it was quite challenging because most of the people know that the bypass can be done to the heart, but there are very rare scenarios where you require to do a bypass to the brain. So in the scenario, we took her for a challenge and we went ahead. We took the artery which supplies the hand, the blood vessel. We took it from the hand and we bypassed it from the neck to the brain, and we joined with the brain blood vessels, which are in few millimeters. And the main artery which was diseased, which was blocked here, so that the blood will not go to the disease aneurysm and it will not rupture. So the blood will be diverted from this artery to the brain, so the brain won't suffer. Because if the disease vessel gets blocked or damages, then the whole brain gets damaged, and the patient will have a life-threatening complications and even the consequences. So that completely changed the life of the patient altogether. And after that, we are very well known center for the highest number of bypass surgeries being done in India now. So I'm being invited as a faculty for the workshops across India and world, and even I'm presenting in India and across the world for scientific research papers and talks in international national platform for the same thing. Great. So it is quite rare to do such surgeries, and we are proudly only one center in a village in India to cater such high-end surgeries without compromising on the technology that we have, the topmost technology in India. And my operation theatre is worth 12 crores with all the topmost gadgets that require to treat these complex deadliest diseases to the brain and spine.
Okay. It is so wonderful to hear, because we all know the bypass surgeries are very common and we get the radial artery graft is put for the heart. But then in the heart, there is a space, because when the chest is opened up, there is a space. But here, the brain, the space is not there. So it is definitely challenging. And what you have done, it requires the heartiest congratulations. And more than that, what is the residual deficit that she had? Did she made a good recovery, or there was some paralysis or something?
No, nothing, ma'am. That's the beauty of the surgery. Because every step matters, and any step which goes wrong or not in an expected way, the patient will have complications. Either she has to face the loss of life, or she will have paralysis as we expected, because if that gets blocked, the whole brain will be damaged and the patient will have a complete loss of her whole body. So this patient, luckily, she completely made a complete recovery, and she walked out of the hospital as if she never underwent any surgery. So that is what is the challenge in the surgery. So every step we have to perform meticulously, because as you told, brain, there is no space. The blood vessels are in the crevices, and to join a blood vessel from the outside, while you are taking a suture, if you put a damage to the brain parenchyma, there will be bleeding and the brain gets damaged. Or while doing that, the blood vessel gets blocked and the whole surgery fails. So these are the highest challenging cases that we as a neurosurgeon face. That's why there are very few neurosurgeons in India who perform this surgery, because one complications will completely demoralize the surgeon and he cannot go for the second.
I know,
so
because
more than 100 surgeries
operation will be successful and the patient will die. That's what the old saying. And that should not happen, because expertise is very important.
Yes, true, ma'am. Yes.
And apart from the expertise that you have, you have the divine blessings also, and the divine intervention. In the AI time, you have the DI also. That means not only artificial intelligence, you have the divine intelligence also, and that is really, really wonderful. And what is the cost difference between the corporate and your center?
Yeah, if you ask me, then there is a significant difference, ma'am. Because the kind of surgeries, what we do, we possess the highest level of skills. At the same time, we have a very good team and the highest level of technology that the patient can dream to have, even in the biggest corporate hospitals. We have everything. And as I told, we work on no profit and no loss. So we perform these surgeries. If you ask me, the bypass surgery would go for maximum with a package of medicine, stay, ICU, everything, surgery charge, surgeon charge, anesthesia charge, including everything. It is hardly cost around 1.25 lakh rupees. So at the same time, it has to be done in a corporate hospital, or epilepsy surgery to be done in a corporate hospital. It minimum crosses around 10 to 15 lakh rupees. So we are doing it just at a 10% cost without compromising on the skill set or even the technology.
Yeah. Thank you very much, Dr. Shivshankar. It was a pleasure talking to you and knowing that such a wonderful work is being done at your center. And as it is called as a Siddhagiri, and I hope and wish that this Siddhagiri will become a real epitome of service to the people with the brain damages or the diseases. And we will talk again over the other conditions also. Thank you very much for giving so much of information about your center and yourself. Thank you.
Thank you, ma'am. Thank you. We are just an instrument in the hands of God, and we both are doing the same job
Yes.
as expected. Yes, ma'am.
Thank you.
Thank you. Thank you. Namaste.